Another condition that I might see in my nursing profession is pneumonia. So pneumonia is when the air sacs in the lung fill up with fluid, and some symptoms of pneumonia that a person might experience is a really bad cough, or they'll have difficulty breathing, and when they breathe they'll have a really sharp pain in their side. And so one way to diagnose pneumonia is by getting a chest x-ray to see where the infection is and how far it's spread. And pneumonia is a life-threatening disease that's mainly going to be more life-threatening to people over the age of 65 or infants. So ways to treat pneumonia would be antibiotics or breathing treatments, and there's actually some vaccines that can prevent a few strains of pneumonia. Another condition that I might see in my nursing profession is asthma. So asthma is a pretty common disease, and what it is when there's inflammation of the bronchioles, and the bronchioles will be inflamed and swollen and constricted, and they'll be producing extra mucus, which causes a blockage in that airway, and it can cause somebody to have difficulty breathing. So these cases could range from very mild to severe, where it's life-threatening, and somebody might develop asthma because of allergies or they smoke. So one way to treat asthma is by giving somebody an inhaler, and the inhaler has steroids in it, which allows the person's airway to open up, which can allow for breathing, or the person might have to quit smoking if they're a smoker. Another condition that I might see in my nursing profession is chronic obstructive pulmonary disease, or COPD. So with COPD, a person is going to have inflammation in their lungs, and then they're going to also have an obstruction in their airway, which causes them to have difficulty breathing. So some symptoms of COPD is shortness of breath, wheezing, and a really dry cough. And some risk factors is that they might be a tobacco user and smoke. So one treatment plan for somebody that has COPD is using a bronchodilator, which is going to open up the airways and allow the person to hopefully breathe better. Or they could use steroids, which is going to reduce the inflammation that they have in the lungs. Unfortunately, though, any type of damage that is caused because of the COPD to their lungs is irreversible. Another condition that I might see in my nursing profession is cystic fibrosis, or CF. So with CF, there's a genetic mutation in the CFTR gene, which affects how your body produces mucus. So normally a person produces very thin and slippery mucus, but somebody with CF will have really thick mucus, and so this mucus starts building up in the ducts and tubes of the body, which causes an obstruction to their airway, and so they have a difficulty breathing. So unfortunately, there isn't a cure for CF, but there are types of treatments that you can do that can help you with your breathing. And one type of treatment that you can have is an oscillator vest. And so with these oscillator vests, you put it over your chest, and then it starts vibrating, which breaks up the mucus, so it allows you to cough it up a lot easier. Another condition that I might see in my nursing profession is a pneumothorax. So a pneumothorax also means a collapsed lung, and the lung collapses because there's a buildup of air in between the lung and the chest wall, and then that air begins to push on the lungs, which causes it to collapse. And this could either be a partial collapse or the lung could fully collapse. And so a way to treat this is by poking them with the needle, which releases all the extra air from their chest cavity.